Welcome to the final Health and Wellbeing Board of this council term. I would say where have the past 4 years gone, but I think we can agree they have been largely hijacked by COVID. But actually looking at the council chamber tonight, this is one of the busiest meetings that I've seen in the recent past. So hopefully this is a sign of things to come as we look towards living post-COVID. So just looking at tonight's agenda, the first item is apologies for absence, and I don't think we have received any apologies. Second item is declarations of pecuniary interest. Are there any declarations? No declarations. And then the next item is minutes of the previous meeting. Can we agree that those are a correct record? I see lots of nods, so we can move on to the main item on the agenda, which is living with COVID. I think I'm handing over to Dagmar for this item.
Yes, hi, and good evening, everybody. So for tonight, I will give you, I've just got 2 slides, and the item comes in 2 parts. So first of all, a little bit of an overview how we are looking at living with COVID, and it's quite important to say living safely and fairly with COVID. So this slide just shows you the different phases. The first one is quite important. We call it the transition phase. It's basically winding down, but winding down and standing down in a way that isn't completely abrupt, but that tapers in a sensible way. And this is particularly important for settings with vulnerable people, particularly our care homes. The other important part is the vaccination program, because living with COVID safely and equitably requires vaccination as one of our most important ongoing measures. And all through the transition and winding down, we mustn't lose the focus on equity. That was particularly important for this board and its subgroup, and we are planning to continue that. The second, in a way, theme or phase is that we haven't got a crystal ball, and at the moment population immunity is high, but we do not know what COVID will look like, for example, in the autumn and winter, and the possibility of new variants. So we're working very closely with our partners, in particularly the UK Health Security Agency, but also the NHS, to be prepared for another surge when we are having to potentially go back into acute COVID response. And then very importantly, the third theme is COVID was obviously really in a way a difficult experience, but we learned a lot and there were some positive things. And so we want to be very, very clear that we build on all the learning and keep the good things as legacy. So these are the 3 themes. And the next slide just reminds you what that means a little bit more in particular, if you move me on. These are the topics that we had in our LOMP, in our local outbreak management plan. So you will be aware, surveillance, you haven't got all the nice graphs today because we are winding down, because with the testing going to be not universally available from 1st of April, there won't be any direct infection rates anymore. So I have no direct Merton data, but it doesn't mean that we're all of a sudden driving blind, but we will need to use national survey data. There are big surveys going on that measure infections, but they also measure population immunity, and we will have to get cuts and apply them to Merton. We also will continue to work very closely with the NHS so that we monitor impact on the NHS. Comms and engagement. There's a lot more emphasis now on civic duty and responsibilities. There are no more legal statute, and that is reflected in our comms. And we obviously have our community champion network that we want to continue. This is one of the areas where we continue and taper rather than having a cliff edge. Infection prevention and control. We want to embed or have already embedded the learning so that when the teams will be tapered down, that there is some legacy left, particularly in care homes and educational settings. So we've trained up lots of people already, and there are toolkits and training materials. Community testing, you will be aware that, as I said, universal testing stops at the end of March, and tests will be still available in care homes and adult social care settings, some vulnerable settings. We are waiting for the details, but generally the idea is that COVID is treated as any other respiratory illness. And if you think about flu, if you think you have flu, you normally do not have a test, but you stay at home until you get better. And that is the type of destination envisaged. So if you are so sick that you need to go to a hospital, then obviously hospitals will have tests, and then some particularly vulnerable people will have access to testing as a means to have access to therapeutics. Local contact tracing has already stopped. 24th of February was the last day. So our local contact tracers are helping us with other things now. They helped with the missing children in education. But just today, I heard that some of them are also helping us to set up the support system for the Ukrainian refugees. So we're very crafty how we use their skill set. And then vaccination, really, really important. All of us have an ongoing role to play because we've got the spring booster now, to all intents and purposes, an autumn booster. There are still young people to be vaccinated, so that is an ongoing challenge. And governance, that segues nicely into the next paper. The Health and Wellbeing Board has set up the community subgroup to particularly focus on embedding equity and with a focus on vaccination equity, but also long COVID and access to therapeutics. And the next report is recommending that the subgroup is standing down, had its last meeting earlier in March. Is in standby mode though, so if ever required, as we said, preparedness for a surge could be stood up again, and that the Health and Wellbeing Board will keep an eye on the particularly important areas of equity, particularly around vaccination and long COVID. So that's in a nutshell where we are living with COVID, and also recommendation for the subgroup to be stood down. Thank you, Chair.
Thank you, Dagmar. Were there any questions or comments to Dagmar, either on that report or on the report referred to on agenda item 4, which is the stepping down of the community subgroup? Councillor Moulton.
Thank you, and sorry I'm just not with you, but actually I suppose it's quite pertinent, but I've been in contact with a fair number of people with COVID at the moment, so so although I'm continuing to still test, and I'm somebody who's been pressing for continuation of testing, because I actually think that's one of the big preventions of getting it and causing more pressure, NHS and so forth, because it's something you can do yourself at home. But at any rate, I don't think I've won that battle, but at least I think it's still got an important part to play. I certainly think that the community champions and so on have been an excellent support for everybody, and I welcome that continuation and the continuation, albeit in standby if needed, of the subgroup, because I think that's been providing some excellent work and support throughout all this. So I just commend the reports and commend all the work that people have done. And yes, I am also intrigued by what's happening in support for the refugees. So certainly I'd welcome the use of any staff and people to provide that extra support, because clearly that's going to be another area for us on the Health and Wellbeing Board to look at, as to how people are integrated within Merton and into our healthcare, but also education systems as well. Yeah, I think if we can all help in that support, then that would be brilliant as well. So thank you.
Thank you, Councillor Moulton. I think actually just to pick up that point on testing, I know, Dagmar, you mentioned that the details are still being finalised in terms of, I suppose, what settings would be eligible for testing. And I know that some of our voluntary sector providers do require staff to continue to be tested. And I just wondered whether there is any further steer on the specific settings, if you're aware, that would still continue to be provided lateral flow testing for free.
Yeah, so I think it's fair to say that it isn't unanimous. It hasn't got unanimous support that the testing relatively abruptly is going to change from universal access to no access, but we are also not the ones who make those decisions. So we've fed back some of our concerns, and we've been promoting to be generous in terms of considering vulnerable settings. The only certainty I have at the moment is that care homes definitely will continue to test, and that is very welcome. At the moment, it doesn't look like support for Ascend settings, which we have been promoting, for parity as well, because obviously health settings are continuing to test, and in SEND settings, the educational staff works shoulder to shoulder with the health staff, and if part of the staff test and the other part doesn't, that has never really been particularly helpful. So there's some discussion and lobbying going on, but at the moment it doesn't look like it. The reason being that fortunately the outcomes, the impact of COVID in young children, even in those in settings, has been better than expected, and I think that is the rationale. Again, we're promoting also that there's more support for the voluntary sector, particularly for carers. But again, we haven't got certainty yet. But if you can put your good words in as well, then we might be more successful. And the other issue that we're expecting is that potentially the price of LFT tests might come down. At the moment, it's quite steep, and you will have seen there have been calculations. So if you want to continue to regularly test, for example, if you are a carer, it adds up pretty quickly. And with already big pressure on cost of living, it's yet another pressure to be considered with. So all of that is still in the mix of being discussed.
Just quickly come back on that, because I did write before Christmas to our MP, and because at one point they were going to stop it, I think, well, they were talking about stopping testing for free before Christmas. So that, and I mean, my letter did go through to the minister and to get a response. And that response gave that UKHSA was the main body making those decisions. So this time round, when April the 1st was mooted, I wrote both to a UKHSA and copied to our MP, I have to say I haven't had a response from UKHSA, and obviously it's disappointing because as far as I can see, 1st of April is a sort of done deal. In terms of, I'm not clear because, as I say, I think I mentioned before, I've got a carer in our midst here, and I'm not sure how he, you know, what's going forward. I mean, we've kept a fair number of tests, but obviously you don't want to stockpile. but it's yeah, I find it quite worrying. I mean, I go around. I'm an invigilator, so I'm in school settings. I'm then up to church for helping on a Sunday at the church, and so you know, you sort of feel you're going around a lot of vulnerable people between us in this family, and so you know, really, it's trying to keep other people safe. And if you know you've been in contact, it just makes sense to me to do a test and you know, and try to keep one's distance and so on. But if you don't know what you don't know, it's pretty hard, isn't it? I suppose. But so yes, I feel a bit despondent on that, but I am comforted by a lot of the work that's going on here in Merton, and from your words, Dagmar. So thank you.
Thank you, Councillor Moulton.
Thank you. I think this is an opportune moment for us in the NHS to say thank you to Dagmar and your team. Wonderful work. You turned things around very short notice, and you established a culture of joint working. I think also this is a time to say thank you to the volunteers and the champions. Whenever I met them on a Wednesday afternoon or Wednesday evening, they were always collaborative. The questions were always positive. There was no negative tone to any of the, even the challenging questions were always purposeful, and you could see that they've totally understood where you were in the testing or we were in the looking after part. And I think it's really something which we place on record today as we wind this down, because I don't think without the champions or the volunteers, we would not have achieved. But all of us here, like people like me, we get paid to do this. We signed up for this from the day we became whoever we became, but these people at the hour of need turned up, which is wonderful.
Absolutely. Thank you, Vasa. Are there any final reflections or comments? No. Okay. And I think we've just extend our gratitude and our thanks to Dagmar and to her team in all the work that has been done and will continue to be done in tackling COVID alongside the wider system that is all part of this team in this virtual room and the room here. Moving on to agenda item 5, we have Chris Lee, who will be presenting some of the findings from Merton 2030 with a focus on health and wellbeing, looking at one of the biggest conversations that we've had with our residents across Merton. So I'll hand over to Chris.
Thank you, Chair. I think Clarissa's just going to put up a very short set of slides. I think we've only got 8. And just to summarise what I aim to cover this evening, I suppose firstly, just to bring colleagues up to speed with where we've got to with Merton 2030, to say a little bit about the next steps that are planned by the council and hopefully with our partners. And then finally, I suppose a call to action really about how this board collectively, but also the individual organisations can contribute over the next few years to delivering some of the actions that we'll need to see to meet those priorities, to address those priorities. But firstly, if we could go to the next slide, please, Clarissa. I suppose the first point here is a thank you to all those around the room who contributed to the development of the plan. The high-level plan was signed off by Cabinet in February, and I've got some paper copies if colleagues are inclined to take one of those away. The electronic version is available online, and as you said, Chair, it is a product of the largest listening exercise the borough has ever engaged in, and that culminated with the set of priorities that are set out on screen there. That's a summarised version, as you'll see, and as I'm sure you're familiar. with the set of priorities. They go into much greater detail, and that high level plan was signed off. And we're now moving towards delivery and implementation of the plan. But given that this is Merton 2030, this isn't a quick fix, and this is something which we as a council are now starting to weave into our business planning processes. We're right at the foothills really in terms of the actions and the steps that we're taking in order to address the residents' ambitions that they've set out. And collectively, I hope that we'll be able to deliver much more. If we turn to the next slide, please, Clarissa, which is about delivery and implementation. And we've got a whole range of initiatives and work activity underway already across the borough. And some of those are identified here. The Workery in Mitcham, which is a co-working space for freelancers, for individuals, sole traders and startups, to help them to develop a successful business model. Similar to the model that we currently host in Wimbledon called Wimbletech, Health on the High Street. I know this board is familiar with that particular initiative with the pop-up health service on the High Street in Mitcham. We're launching a new apprenticeship scheme that's been particularly led by Children's Schools and Families, focusing on those, I suppose, more challenging in terms of their distance from the workplace, particularly young people such as carers who in those particular roles. We want to support them. And we're working on an app for local businesses to be able to connect more with customers who are used to dealing online, but those businesses are particularly small and aren't able to support their own facilities and their own apps. So we're working with a proprietary business app to be able to link them with those businesses and customers. There's quite a chunk of money already been set aside to support the delivery of Merton 2030. So in addition to 2 million that's been put aside for carbon reduction in the next 3 years, another 1 million has been put aside specifically for a range of other Merton 2030 activities. Quite a large amount of that invested in my department, focusing on cleanliness, improving street cleaning, improving enforcement activity, but also a pilot park ranger service. One of the very significant messages from the consultation and engagement with residents was the importance that they place upon our green spaces and the need for us to utilize those more successfully. And I think that's a particular message for this board, because the opportunities in our parks and green spaces for improved health, improved quality of life are enormous, not just in terms of access to sport and leisure facilities, but also places for quiet contemplation, places which people have enjoyed during COVID to improve their mental health, places for people to meet, and also a sort of a catalyst for getting involved in other activities and increasing social capital. So whether it's Friends of Parks or other activities in and around our green spaces. We turn to the next slide, please, Clarissa, which is really just a fairly crude Venn diagram, just illustrating the connectivity, the overlaps across all of these 5 priorities. For example, retrofitting homes in the housing area there would reduce fuel poverty and carbon emissions, but also cut across in terms of greener Merton, with links to local economy in terms of jobs and skills. And underneath all of this, there are a set of 10 principles, with fairness and equity being absolutely key there, and equality alongside that. If we turn to the next slide, please, Clarissa, because this is, as I said in the introduction, I was going to say a little about what's happening next. And we're moving into a phase which is about taking stock and discovery. And this is beginning within the council to firstly look at what we're already doing right across the council, which is linked to the delivery of the 5 priorities. So taking a fresh look at that to see what are the timescales, what are the dependencies, and how we can ensure that those particular activities are delivered. And then secondly, what's in development or being worked on, what ideas have we got which are coming up fast, where we can look at ensuring those can be delivered to support the priorities. And then thirdly, what can we do differently? How can we rethink some of the activity we've already got in the council's business plans and possibly with partners to think about the scale of our ambition and how we could look at it in a different way in order to boost it and to ensure that it can, over the next 8 years, deliver against those priorities more successfully. How can we tweak it in order to ensure that it provides some of those co-benefits? So that's what will be undertaken very soon. And I suppose it turns to the role of the Health and Wellbeing Board then, because there are some particular areas that are identified in the Merton 2030 plan, where there's a very clear role and opportunities for the Health and Wellbeing Board to get involved in, as I say, either collectively or through the individual organisations that we all represent. So those areas, most obviously around regenerating our high streets as community hubs. Just last evening in this council chamber, Cabinet received a report from Scrutiny Task Force looking at reinvigorating the high streets, and that came across very clearly from residents that they want to see those, that they recognise that high streets are changing, that the power of the internet has moved us on from the way we used to use high streets, but they want us to invest more in those as good quality, healthy public spaces and to use them more as community hubs and to allow people to take more pride in those spaces, get more health outcomes onto the high street. I've mentioned green spaces, and I think the opportunities are endless there in terms of the use of our green spaces to link into the social prescribing, to improve the quality of mental and physical health for our residents. Skills and employability, getting people into meaningful work, a big focus around apprenticeship program, the workery I mentioned earlier, and work that we're doing with the Chamber of Commerce and Business Improvement Districts, supporting residents in need, and then housing supply, conditions and quality. And a big emphasis across all of these around place, and some initiatives going on outside of the council, which will help us. I'm sure you may have picked up on the Mayor's intention to consult on expanding the ULEZ, which has got real positive benefits and opportunities to improve air quality. And air quality, a big focus within Merton 2030, and a big issue raised by residents alongside carbon reduction. So just a couple of slides left really. In terms of timing, the taking stock and discovery work that we're engaging in as a council taking place now, right through until after the election, with conversations with partners, other agencies, and we're aiming for a summit in June with partners. So that'll be the Merton Partnership and a range of other invited partners around the room in order to get involved in what's the next phase of delivery against the Merton 2030 ambition. And as you'll be familiar, we are expecting after the election a new cabinet to be formed, and what they aim to do with Merton 2030 will be entirely down to the next administration. But there's a great opportunity really over the next few months for partners to get involved and help shape this, because although the high level plan is there, with another 8 years to go, there's an awful lot more work that can be done. And as I say, that call to action. So the last slide, if we could. I suppose I was in reading the papers, I was reading the Merton Health and Care plan, and there's a good read across there really, particularly to Merton as a healthy place, and what can we do collectively. Dagmar and I just recently held a joint DMT meeting to reinvigorate the work between my department and public health, where an awful lot of good work has been undertaken in the past, but we've identified a short set of priorities to work on collectively in order to drive forward the public health agenda through some of the tools that we have within environment and regeneration. As I say, there's a great opportunity around the prevention agenda, tackling some of the sort of common ills and problems that we face, whether it's smoking, alcohol, healthy food, physical activity, and getting residents into more active travel, whether it's environmental sustainability in the work we're doing around air quality and carbon reduction, or about embedding equity and tackling inequalities across the borough. So I'll leave that slide up, Chair, just as a reminder of the priorities, but happy to take any questions. But as I say, a call to action really, not just at this meeting, but ongoing to how we can, through the Health and Wellbeing Board, identify some joint activity and action to respond to the priorities. Thank you.
Thank you, Chris. And as you say, a very timely report as we talk to the Merton Health and Care Plan. And I think also as we look towards the integrated care system as well and our sort of joint system ambition, it's a nice time to look at those key themes identified through that conversation. I can see Simon has his hand up.
Thank you, Chair. Good evening all. Sorry I can't be there. Yeah, thanks, Chris. Good presentation as ever. And, you know, I think there's so much good stuff in the 2030 plan. You mentioned the link with social prescribing and green space, which I think is proving to be really important. And you're aware the stuff that's developing with green social prescribing, which is the sort of outdoor version, I suppose, which green spaces will be crucial for. One thing we just looked at our current stats on social prescribing, and we've got an enormous increase around mental health, which came through the pandemic, but more recently through finance pressures. And the question really is, with the 2030 plan, it's great to have that long-term perspective, but what's the mechanism for adjustment? Because if you look at the unfortunate situation in Ukraine at the moment, it's driving what was already a fuel price problem going into the autumn in particular. It's going to get very much worse. And also there's a lot of implication that food prices will get dramatically worse as well. So we're seeing it already through social prescribing issues of financial and food poverty and fuel poverty coming through. So is there a mechanism in how the 2030 plan's managed in terms of something that wasn't really quite envisaged when the plan was drawn up? Thanks, Chair.
Yeah, thanks, Simon. I think from the council's perspective, it will be the annual business planning and service planning cycle that we will use to adjust and respond to the changing nature of the environment that we live and work in. So we'll use that cycle as a bare minimum, really, in order to make sure that it remains a sensible plan and that the actions are adjusted to take account of that.
Thanks, Chris.
Mark, did you want to?
So Chris, thanks for the report. And again, I think it's really important that we link all our plans up, aren't we? Because there's a golden thread around social prescription, green spaces, healthy lifestyles. And it's a plea to us all really to just make sure that we are talking and making sure that we're linking it up. And I do think actually your plan has really, it has real indicators in terms of primary care access and how we shape services going forward. And I think over the period of the next couple of years, given the pressures Simon mentions, as well as, we know that we're going into, financial restrictions are going to come back, that we haven't got the COVID money that we had before. So I think it's just really important that we work as one. We work as one Merton and work across the different plans that are there.
Thank you. Dagmar?
Yeah, thanks. Thank you very much, Chris. I think it was a really good example, and obviously we were all part and parcel of development of Merton 2030, that it comes across as creating the conditions for people to thrive. And if you think about what our health and well-being strategy is all about, it is the creating the conditions for people to thrive, going hand in hand with delivering integrated health and care services. And that's precisely, Mark, what you were saying, is it's not that we go our own merry ways, but that we're doing it hand in hand. Yeah, and for me, that is really exciting. You will remember, as a health and well-being board, we have looked at the concept of health in all policies, simply again as a way of working and weaving the different approaches together. And we're planning to refresh this so that we're looking at equity, well-being, and environmental sustainability all in a bundle, because they are really so intrinsically interdependent. And as everybody now has said, and Merton residents have said so loudly, the green spaces is something quite special for Merton, and it's one of our assets. We are not only defining ourselves through all the deficits, we have actually really good things going, and so making the best out of our assets for mental health, connecting people, physical activity, a really big opportunity. So watch that space. I think health and all policies will come the way to the Health and Wellbeing Board as well. And thank you.
Thank you, Dagmar. Are there any final comments or questions? Maybe just one from me, Chris, just in terms of, I think you mentioned sort of a summit where partners come together. I just wondered, because I imagine there are a number of examples of work that colleagues across the board will be undertaking that fit into those themes. I don't know whether there's sort of an existing mechanism in which that can be fed back either via the board or individually, or whether you have sort of a sense of how that might work best.
So if you don't mind, Chair, I'll take that back. I'm not the architect of that summit, but I know somebody who is. And perhaps I'll talk to John Dimmer and see how the board individually and collectively could best contribute in advance and hopefully at the summit.
Great, thank you, Chris. And thank you for the presentation as well. Moving on to agenda item 6, that's access to primary care. And I think Mark Rillman is going to be presenting on this item.
Thanks, Chair. And I'm assuming, Clarissa, you'll load my slides up. Thank you. So what we've got here is a bit of a hybrid of a paper, actually, because what we thought was important is that we, as we are living with COVID in a different way, is that we actually really start to look at access issues for our communities. So what you've got is a bit of a position statement and some facts and figures, but we do think over the next 2 years, this is something that we need to build, and we're touching upon some of the subjects already in different parts. So we wanted to give the board a kind of overview of primary care access at the moment. Next slide. And we're just going to run through a number of areas. Keep going, Clarissa. Okay, so with Merton, again, it's important just so that we know the facts and the figures. It's 22 GP practices, just over 230,000 registered patients, 6 primary care networks, 1 federation. Of the practices, we've got one outstanding practice that's in the top 20 in London. We've got 20 good practices, and we've got one practice that requires improvement. And just to say that one of my teams actually works with that practice to make that into a good practice going forward. There's been a lot of media coverage about GP access, and it is important to just touch upon, although the GP patient survey has a relatively small sample, actually 82% of people rated their experience of GP practices as good, and 71% rated their ability to make an appointment good as well. Now, it's the other 29% that we're interested in. So next slide, please, Clarissa. Access to GPs is predominantly Monday to Friday, 8 to 6:30, and that's their core hours. And all practices in Merton offer telephone, video, face-to-face, and online consultations. Now, they don't all offer it on the same ratios, and that's something that we are now beginning to work with every practice on. They have a range of staff, including GPs, nurses, etc. But a really interesting development over the last few years is that we are now employing alternative kind of practitioners, such as pharmacists, paramedics, mental health liaison workers, physiotherapists, all within the kind of primary care setting. And it's worth noting that South West London is miles ahead in the recruitment of those posts than any of our London neighbours. Considerably more alternative disciplines have been recruited. There's also extended hours, so that's offering clinical sessions outside of the 8 to 6:30. It's funded separately. Again, it's still telephone, video, and face-to-face. But actually, again, it's delivered through most practices, and it's through local schemes, and also with our extended access hubs, which I'm going to come on to the next slide. So access hubs in Merton, we have 6, each aligned to a primary care network. We have about 1,500 appointments per month with a GP, either by telephone or face-to-face, and then we have 650 nurse appointments per month as well. All practices can book into these additional appointments, and as can emergency departments and the NHS 111. So actually access into the access hubs can come from a number of referral routes. Next slide, please. Now, over winter, we saw extreme pressure in all parts of the system. Our hospitals were under extreme pressure. Primary care was under extreme pressure. So we opened a telephony service between December and January. And that was really to kind of assist on pressure and that people could get a primary care consultation when they needed one. And it was advertised through text messaging, practice websites, and answer phones. It was hugely successful. 21 practices kind of signed up to it, but we saw over 4,000 additional appointments offered, and that's massive. Now, we know we can then set this up very quickly, and the plan is that if we need to, we would look at Easter or holidays or particular points in pressure. But we also have to learn from that, because one of the really key things is actually if we are able to divert cohorts of patients to have telephone appointments or indeed face-to-face appointments, then that's what we should be doing. We should be considering the different cohorts and the different channels of access that we need to put in place. Next slide, please. COVID vaccinations, I'm not going to spend lots of time on this, but just to say that we continue to do the vaccinations and we continue to work with our PCN sites. We are planning for the future, the 5 to 11-year-olds. The evergreen offer is really important. It's really important that we keep going with that offer. We keep talking to the communities and we keep talking to the individuals who, for whatever reason, have an access issue to the vaccination and the booster. Next slide. A little bit more about our primary care networks. I won't go into the DES, that's a contract term, but just to say our primary care networks provide extended access, the additional roles that I've just spoken about, enhanced health and care homes, which has been very supportive, not just in COVID, but prior to COVID, just about primary care, supporting care homes really effectively. That includes structured medication reviews with pharmacists and early cancer diagnosis. Next slide, please. So the key issues in primary care, we are seeing increasing demand. Perhaps Karen and Vasa might want to touch upon that after me. Workforce, I think workforce is not only in health, in social care, across all our sectors, workforce, we have challenges that we need to work together. We need to make sure that we're dovetailing our activity, but also we're not duplicating our activity. Estates, we know that there are estates pressures in primary care. We need practices that are fit for purpose, that perhaps are offering not just primary care, but a primary care plus model. We've got a backlog within the NHS on COVID recovery. It's really important that we catch up on those routine reviews, those immunizations, etc. But we are seeing also a shift in the workload from secondary to primary care. So actually, some of that is appropriate, but some of that needs to work through, because actually we need to ensure that the resources are there in primary care to capture that workload. We've seen an increase in child and safeguarding cases, and we are continuing to work with our primary care networks. I would say in Merton, we're very lucky with our primary care networks. They are quite mature, they're quite developed. But again, we are moving into the integrated care system. This is new. We need to make sure that we are not dropping the ball because of structural change. We have to keep the focus on inequalities in service delivery. Next slide, please. Just a mention of out of hours. So out of hours is Monday to Friday between 6:30 p.m. and 8 a.m. and then Saturday and Sunday 24 hours. So you can have a home visit, you can have face-to-face, or indeed a telephone consultation. The NHS 111 is 24 hours access telephone. It should be able to book people into your local services, whether they be A&E, urgent care, emergency dental, or indeed the GP practices. So again, that's part of the kind of the jigsaw of access that we need to make sure is functioning correctly as we go forward. Next slide. We just wanted to touch upon social prescribing. It's always worth shouting about successes. It's a highly commended service in Merton, an award-winning service, but it is a partnership, and it really is something that we should celebrate and enhance, because as we go forward, this is going to be a really key part to controlling access and making sure that the right people are seen by the right person at the right time. Next slide. I'm not going to go through this in detail, but just to say that we've got 10 social prescribers supporting patients in non-medical areas. That's a wide range of multi-professional backgrounds. Referrals can be made through clinical staff, and you can get up to 6 appointments in 60 minutes each per person. Patients are offered a follow-up appointment, and we've got access to 800 local voluntary organisations. That is huge. But the one thing that I think, picking up on Simon's comments, what we need to make sure is that our voluntary sector has the resources to deal with this, and that actually our voluntary sector are, if we are seeing more mental health presentations, actually we have access to more mental health support in the voluntary sector. Top reasons for referral: mental health, social isolation, picking up on comments earlier, financial advice and housing. So it's not just about health, is it? It really is about the broader determinants, and that's why we need to make sure we're linking up. Next slide. Go back a slide, because I think this is a really important one. It works. And it works because we have been able to look at well-being tools that basically show that life satisfaction, feeling worthwhile, overall happiness, decreasing anxiety, that actually the social prescribing model and making sure that people are directed to the right support really does make an impact and has a positive outcome on patient lifestyle. Next slide, please. The future of prescribing. I think Simon mentioned green social prescribing. I liked his phrase, outdoor social prescribing. I think I'll use that in future. But we also want to develop it into children and young people's social prescribing as well, and adopt a kind of cancer link worker model, which is currently established in Wandsworth, and we want to learn from our neighbours where they do great things, and vice versa, we want to share when we do great things. Next slide. Community pharmacy. Now, we currently don't commission community pharmacy locally, but it is coming as part of the ICS, but it's probably coming next year, or maybe a little bit later than that. There's some conversations going forward at the moment. But what we do know is we know that community pharmacies is a great untapped resource, I think, and we need to tap into it more. We saw it deliver COVID vaccinations. We had 2 pharmacy sites in Merton. We are using it to pilot earwax service, which is exactly what it sounds like. But I think what we need to do is actually tap into community pharmacists as a destination for support and healthcare. Next slide. So we have undertaken a bit of a pharmacy campaign. The objectives is to reduce A&E attendance, but also to make sure that people are actually encouraged, and those are working aged adults and parents and the under 5s, to actually view pharmacists as a first port of call. So rather than waiting for a GP appointment, is actually you can use your pharmacist. And we have also discussed in the past, Dagmar, about kind of a voluntary sector health visiting service. And there is something about particularly our under 5 services that we need to look at. We did this by promoting the services and promoting the expertise in pharmacists. And we are gauging with local pharmacists within a 1-mile radius of the A&E department, the local A&E departments. Next slide, please. I promise I will finish shortly. A range of pharmacists. It's not just about the disposal of medicines or the prescriptions. It is about advice. It's about vaccinations. Can be about weight management. It can be about emergency contraception. The list goes on. So what we really do need to do is start to work with our community pharmacists on making sure that our public and our residents know how to use them and when to use them. Next slide. This is just I just wanted to blind you with science, because what we did was we tracked people and we exposed them to some advertising around community pharmacists. And actually one of those ads, if you saw one of those ads, you were 4.5 times more likely to use your community pharmacists than if you hadn't seen the ad. So actually what we are going to do is we're going to kind of, next slide please, Clarissa, sorry, is we're going to have an integrated campaign. We're going to promote it through health and care staff, talk to our partners about pharmacy as we go forward, but really promote it through communities and use different channels of social media. Next slide. I just wanted to touch upon another access initiative, and that is the Community Hub in Mitcham. I wanted to just update the outgoing administration that in principle that the Wilson has been in principle agreed as the Community Hub site going forward. And now we move on to writing up the business case. The reason I'm saying in principle is we've got a few questions with the Mental Health Trust just to work through in terms of the current services being delivered and the size of the site. So we do anticipate that that will be a fruitful conversation, but the Wilson will remain the site, and we will start writing that business case. It's already started for completion by next summer, and that's the business case, not the site. So it's the business case. I just want to be really clear and set expectations. Final slide, you'll all be pleased to know, is health on the high street. I think Chris mentioned that it was just to say again around access, taking our services out into the high street, out into the community. And it's, you know, there's a wide range of services that can be accessed, whether it be vaccination, whether it be primary care, whether it be sexual health, etc. And what we want to do is just really maximize the impact of this and make sure it's part of a wider kind of a wider jigsaw of services across the borough. And when I said final slide, I was actually lying. There's one more slide, and that's just to say that within the health on the high street, we're starting with community libraries. We're looking at pop-up and community venues, and we're linking it to different campaigns, but there's going to be on-street engagement, and the vaccination champions are part and parcel of that going forward. I'm going to take a really deep breath and then ask for questions or comments.
Thank you, Mark. You've taken us through hopefully the whole raft of primary care provision, but also I think a bit of an evolution towards the sort of preventative type provision as well as part of Health on the High Street, and also the Wilson. Are there any questions or comments for Mark on his presentation? Was that comprehensive that I can't see any?
Can I?
Oh, Dagmar, yes.
Yeah, so first of all, thank you, Mark, because I think not knowing what is on offer is often part of the issue. And the reason why we wanted to bring it to the Health and Wellbeing Board again is that anecdotally, we've got the GP survey, but all of us anecdotally through our networks do have the feedback that access, particularly to GPs, is not always straightforward. And we wanted to make sure that as a Health and Wellbeing Board that cares about access, particularly equitable access, that we really understand as a first step what is already out there, and then start to marry that in a way with the feedback we get, so that for future models like Health on the High Street, like the Mitcham Community Hub, we really tune in what combination of services are most useful for the need of our residents, because we can have our professional opinions, but it is really important to tune in and listen and hear what is it that hinders access. So I think it's a really good start, and in a way, Chris, it links as well into the Merton 2030 ambition, when we, for example, think around how we develop our estate, where are we putting what longer term. So I hope as a Health and Wellbeing Board, this is not like done and dusted, but primary care and access to the first, in a way, entry into the health and care system. This is so fundamentally important that it's a start of our engagement with this topic rather than the end, and really welcome.
Thank you, Dagmar. Can't see. Oh, I can. Vasa.
Thank you, Dagmar. You make a very valid point there, especially on the equity agenda. Access is so crucial and so fundamental that you get timely access. And it's important that we are not complacent in the NHS about the access. We, as Mark himself said, we don't hide behind the 71%. We have to look at that 29%, because those 29% may be the people who are disadvantaged by the issue with access. And when we talk about access, we also have to realize that we solve the access issue by doing prevention and self-care, pharmacy care, social prescribing, mental health support. If we get all that right, then we will solve the issue of access. And I think this, both the paper from Chris and the paper from Mark actually need to be married together, because it's about creating the environment on the high street, in the green space, in the health space, working together. And I would hope that one day in my lifetime, we actually stop calling things the public health agenda. I think it has to be the citizens' agenda. It's not under Dagmar's directorate, not on a floor in office issue. So as public servants, when you look at something, we follow the Nolan principles by instinct. We don't actually say, oh, think of Nolan and then get it right. We know that we got to get it right, and we know that we got to be Nolan compatible. Similarly, I would challenge all of us in everything we do we pass the test of prevention? Do we pass the test of equity? Do we pass the test of justice? These have to become second nature to us. As much as Nolan is second nature to us on the issue of probity, we got to get it right, that every department, every floor, every officer, every healthcare worker remembers that whatever we do passes the test of equity, fairness, and prevention as an instinct, not as a bolt-on, as an instinct. And if that day comes in my lifetime, I'll be happy.
Mark, did you want to come back at all?
Thanks for that. And I think all really good points. I think one of the things that we shouldn't underestimate, though, is that it's not just about the service delivery. It's about working with our communities on access and how they access services and where they want to access services and what works for them. Because, you know, it's not just about a GP practice or an A&E department. Actually, when we are implementing some of these new things, we have to be consistent in the delivery. We have to let people get used to it. We have to work with communities in promoting it. So I wouldn't underestimate, we've also got a lot of work to do with our communities when we deliver things in a different way.
Thank you, Mark. Thank you for your presentation. I think it very nicely actually moves us on to agenda item 7, which is a refresh of the local health and care plan. And I know that Gemma Dawson is going to present that for us.
Yes, hi, good evening, everybody. I'm Gemma Dawson, and I'm taking over the mantle from Jen Goddard, who's done a lot of the work who may previously presented to you at the meeting in November. So hopefully you will have in your packs, have received the paper and also the sort of long slide deck, which outlines where we've got to on the local health and care plan refresh. And the purpose of bringing it today is really to give you a flavour of the detail that we're doing and building on the summary document that you discussed at your November meeting, which had identified some of the key priorities to focus on over the next 2 years in partnership. And I think I just wanted to say at the beginning that we're not presenting you a full sort of polished, finished article here. This is very much still a work in progress. And I think that really encapsulates the spirit of this plan, that we want it to be dynamic. We want to carry on the conversation and the engagement that's taken place through members of our community and across health and social care in the refresh. And we want to carry that through into implementation. We want to make sure that this plan responds to other emerging priorities, particularly Merton 2030 and some of the things that might come out of the summit and the more detailed planning that might happen there, and also other strategies and plans that will happen and come our way. So the purpose of today is just to kind of give you a bit of a flavour of some of the detail of how we're kind of building up this plan so that we've got something to work through. I'm really interested to get the steer from the board on and your direction so that it can be shaped and pushed in the direction that you want. Could you move to slide 6, please? I brought quite a lot of slides, so I think I'll just sort of do it a bit more revised. But as you all know, this plan has been developed through a number of conversations and engagement activities and forums that exist in Merton. And also it's heavily informed by the refresh of the Joint Strategic Needs Assessment and the Merton story. And also from some of the experiences of implementing the plan from 2019 through to 2021 and the experiences of working collectively and collaboratively to respond to the coronavirus pandemic. As you also remember, this plan isn't everything that we do in Merton. It's just those things that really benefit from a partnership approach. So it's just distilling out the key things that we really need to work together on to make the greatest impact. And you can see here the vision that we have for this plan over the next 2 years of what we want to do, and then how that translates into each of the 3 life course areas. You can just move to this. Is great. And I just wanted to highlight the kind of key principles of the plan. So there are some specific focus areas, and we want to focus on specific issues where we know we need to have a targeted approach. There's some general themes around improving access and information, and as picking up on the themes we've just discussed about exploring innovative and new ways to improve access so that all of our residents can have the best chance to have a health and to improve their health and well-being. But across that, there's also golden threads. So about strong things around reducing health inequalities and embedding equity in everything that we do, making sure that we take an evidence-based approach using population health management to inform and measure the impact of what we're doing. There's also strong overlap in terms of looking at sustainability and making sure that Merton's a healthy place. And through all of that and everything that we do in this plan, we want to make sure that we're engaging with service users, patients, their carers, and the wider community so that this work is developed with and by the people in Merton. If you could just move to slide 8, please. And I just want to take an example. I'm just going to talk in detail about Live Well. So if you could just flip to the next, sorry, yeah, I did give Clarissa too many slides, but so I just want to talk in detail about Live Well. So for each of the 3 life course areas in the plan, we've identified thematically a sort of what we're going to be focused on, sort of 3 key areas as a rule of thumb. So for Live Well, we really want to change how people access health and wellbeing services. So this picks up on the themes we've already discussed this evening around exploring new models of care, new innovative ways, joining up what we've already got and working collaboratively. So Health on the High Street's the key project there, and also looking at taking learning from other areas in South West London about looking at approaches to improve ethnic disparities in mental health and how we can work differently to make sure that everybody gets access to the services that they need. And also strong ideas of making sure that we can tackle obesity and by improving the personalisation that we have. We want to improve the access and information to primary care. So again, it picks up on some of the themes that Mark just talked in his presentation about pushing through that, that we promote all of the different routes that we have, particularly around pharmacy, and also making sure that everybody has access and how we can work collaboratively to share the information. We think there is lots of good work going on and we need to work and join up to share our information across so that we can signpost and make sure people can get access to what's already out there. And of course, we want to be focused on prevention. So we want to work specifically here on diabetes and through obesity, promoting weight loss management and healthy eating approaches, and also getting out and more exercise approaches. If you could just move down to slide 11, which is the next one. Yeah, and so inside the plan for each of the life course areas, we've started to develop more granular detail. So we're mapping out these descriptions of our projects or initiatives. So for example, the Health on the High Street approach. We're starting to really building this granular detail about what's the impact going to be, particularly from a resident's perspective. How will that actually feel different for somebody who lives in Merton? And how will we know that has worked? How we're going to measure that, how we're going to see if that's made a difference. So for each of the projects we've identified in this plan, we're starting to go through and with a fine tooth comb really and doing this detailed work. And it's our hope that we will drive the implementation through our well-established Merton Health and Care Partnership Board, which has all of our partners across the borough working together, meeting monthly, so that we can monitor progress, our implementation, and steer and guide to make sure that we're getting the results that we want. So I will just leave it there really, because there's a lot of detail in the plans, and there's lots of information across Start Well, Live Well and Age Well, and some of the background information and also some of the detailed feedback that you could see throughout the engagement phase, so that you can see the sort of logical route really that we've got to on that plan. And again, just to say that the work continues on this plan and it will iterate and develop over the next few months, but also crucially, we'll begin implementation through our Merton Health and Care Together Partnership Board. And I guess the 2 points I want to ask from the board really is if there are any key steers or any points of feedback on this emerging plan, and also if there is any steer or advice on how you would like to be kept informed of the progress and the implementation as we move forward delivering the plan over the next couple of years. Thanks.
Thank you, Gemma. And it's great that you brought this item at this point, I think, because just reflecting on the previous discussion, there's a huge amount of alignment, which I hope colleagues would agree with. Are there any comments on the presentation or the paper, or possibly any questions on the sort of emerging local health and care plan? Well, Dagmar, then Chris.
So if I can start. So thanks very much, Gemma. You help us really a lot with keeping us on track and putting it all in a nice presentation. I think it was good as an example. You focused on Live Well because we pressurized you in not having so many slides. And so now I will actually draw attention that the Health and Wellbeing Board is obviously responsible for Start Well, Live Well and age well in a healthy place. And I wanted to particularly draw attention to the real good work that children and young people are doing themselves, articulating particularly what the experience was during the pandemic. But we just had our young inspectors presenting to our public health team, sharing their video, and it made me think again how important it is that when we talk, we work with our community, that we are absolutely including children and young people, and that is relevant for the services and the access that we've discussed previously, but also to take leadership for a healthy place. Young people care for where they live, and it is their livelihood and it is their future. So tapping into their ingenuity and in their fun, into their imagination, I think we haven't quite done this justice in the past. And if you haven't seen the video, I would strongly recommend it, just to give you a glimpse of the energy that sits there as well. And we've got obviously Jane also on the board to make that plea. And in the same vein, COVID was really a quite alarming period where intergenerational work, particularly in the first wave, was undermined by the slogans like "Don't kill your granny," that in all honesty were used to influence assumed behavior of youngsters, I think in a failed attempt in my view. But leaving that aside, revisiting and rethinking about all the benefits that intergenerational work actually has, and rebuilding some of what we've had to give up for a bit, and re-energizing trust and confidence. And because again, there are lots of examples from not just our own, borough, London, the country and elsewhere that we could build in, and it fits again very well into the Merton 2030 vision. So I leave it there, but exciting opportunities.
Yeah, I suppose there's a bit of a theme. So thanks, Gemma, for the presentation. And I know you came along to CMT as well, and we received it there, and there was some helpful feedback. I suppose the more I read the plan, the more I'm particularly interested in the healthy place aspect of it, and I'm interested in whether you see that as the same status as the other three main themes in the plan, because I see it, I suppose naturally because of my background and responsibilities, as one of the main areas that I can contribute to and my department can contribute, and one of the main areas where the prevention agenda plays a very large part. So I'm interested in how much you think that the focus will be in terms of action planning around that particular aspect of the plan, and I suppose opening the door for collaboration and joint work around that, because I see there's real exciting opportunities there. And just to reinforce the point about young people, I was lucky enough to be at the Merton Partnership where the young people came along and presented, and we've invited them to come to our departmental management team, because there's some very important messages for our service managers, particularly around public space, around safety, around parks, and how we plan the future use of those with young people to make the best of them. Thanks.
Thanks, Chris. Gemma, did you want to come back on?
Yeah, thanks, Chris, and Dagmar. And I think absolutely that's a really great point to make as we go through developing the detail and the action planning. That I think you're right that we should have make sure that we don't. I'm not sure we've done it yet, but I think that could be a great challenge to make sure that we don't lose the focus on that, and make sure that has just as much weight as the other areas that we're perhaps more conventionally lend ourselves to and put the focus on. So I think making sure that we have the rigor to and the commitment to doing our prevention initiatives is key, and I think that could be a real strength of this plan. So thanks for that reminder.
Thank you, Gemma. And Vassal?
Thank you. Yes, just we must not forget the importance of a healthy workplace, because if you look at it, a lot of your awake hours are spent at work for those who are at work. And when you see people as patients, when they come and sit in front of me, a lot of the reasons they tell me about their problems are actually work related or work created at times, both mental health issues and physical health issues. So things I want them to do for their physical health or mental health are constrained and shackled, and actually sometimes adversely affected by workplace. And I think we really need to address this more openly than we do, and we need to call it out when it doesn't really help. It actually hinders people, because it disadvantages people far more than the people who run the workplace are actually blissfully, ignorantly unaware of it most of the time. It's not intentional. It's actually totally unaware of what small adjustments can be done to help people along a long way. So we really can't lose the touch of that. And I'm happy it's featuring there, and happy we are discussing it, and we can carry on focusing on it.
Thank you, Pastor. Mark?
I just think wouldn't it be wonderful if this time next year our young inspectors were presenting this plan, that actually that our residents, this was their plan for what they wanted to see. So I think how we capture that voice, we are officers, we should be there to deliver, obviously, but I just think there is really something about, you know, engaging with our communities, letting our communities tell us what's important to them, and I think that's across all three presentations we've had today. And then the thing about population health management, my heart sinks whenever we use those three words, because I think it's really important that we don't think that this is something terribly new and that we're waiting for a shiny data set, because we've been doing this. We've got public health data. It's about evidence-based interventions. So it's like, let's not wait for that shiny deck of papers, because they may never arrive. But we do know a lot about our communities, and we know a lot about where we should be aiming our services. So we should actually just get on and do it a little bit.
Thank you, Mark. Phil?
So I guess similarly linked, and I think there was a point to bring this up in all three presentations, which is around, and I won't use population health management or data, but it is that information, that intelligence that we get back from what we put in. So I think we're quite strong on it in setting that up from the outset when we're designing plans. But, you know, listening to the presentation around primary care, I think GPs are a great avenue for intelligence for me to understand what's needed from a social care perspective. Similarly for Simon, from a social prescribing perspective. And it's that full circle of checking that those things that happen actually work for people, and running the tightrope of not being paternal and saying, putting this in place because we think this is what's needed for you, but actually understanding from people what works. Is it equitable across the borough in terms of how that's delivered? And that will help these plans be more agile and hopefully successful than just the long term looking back. Have we delivered over 5, 10 years, etc.
Thank you, Phil. Jane?
I suppose just building on the point that people have been making. So I think it would be great if the young inspectors did come back and present, but I think it might also be, we could think even more strategically than that and think, should we have a young inspector on the health and wellbeing? But I'm thinking of lots of things we've discussed today and how we want to get those messages out to our communities, and they would be great in terms of being champions there. They link in with lots of so they sit on strategic boards in terms of CSF, in terms of children, schools and families, but sitting on some other strategic boards I think would be really helpful to spread that message. So maybe we could think about that.
Thank you, Jane. Gemma, did you want to come back on any of those points? Or?
No, just say thank you for those comments. That was great.
Great. I think those are all the comments and questions. So thank you, Gemma, for presenting, and we look forward to seeing as it evolves and develops. So I think we're on to agenda item 8, which is future meeting dates. And Bola, I think you might be telling us a bit about future meeting dates.
Sorry, Chair, would you like me to read out the dates? Okay. So the dates that were decided by Council was 21st of June, 2022, 20th of September, 2022, 29th of November, 2022, 24th of January, 2023, and 28th of March, 2023.
Lovely. Thank you, Bola. I think we can all agree those dates for future meetings. And just before we do formally close, and I realise that I have managed to chair quite efficiently this evening, earlier than usual, but I just wanted to close tonight's meeting, the last of this term, with a few words, as I know this will be the last for some of us. And I firstly wanted to pay tribute to Chris Lee, the Council's Director for Environment and Regeneration, who will be retiring at the end of June, I believe. I know that Chris will be a huge loss to the Council, and I know firsthand, as I've had the privilege of working with him not only on this board, but also as my Director across Transport and Air Quality. To me, Chris has always been the voice of reason and has an expert skill in staying measured and balanced, even when possibly the politicians among us may come to him with a complete 180. But more seriously, Chris has actively helped lead health and all policies, as Dagmar mentioned earlier, and also our ambition to tackle inequalities in his department, which I think shines through as part of Merton 2030 as well. And Chris, I know I speak on behalf of the whole board when I say thank you for your, I think, almost 13 years of service to Merton. And I hope that you also see the seeds that you've sown during your time here continue to develop over the years and decades to come. And I think this is just a small gift on behalf of the board, which I will lift up. And I will also just quickly go on to say, as many of you know, this is also my last meeting as I stand down at the next election. And I just wanted to say that I feel really privileged to have been part of this team that's really working to make Merton a better, healthier and fairer place. And I'm really glad that we have been able to see that throughout the course of tonight's meeting. I thought I'd also close with a bit of a reflection. I think since I joined the council 4 years ago, sitting on healthier communities and also on this board, I think there's been a really key theme running throughout, and that's one of partnership. And I've seen this through two lenses over the last 4 years. I think the first is through the sort of integration mandate that came through STPs and ICSs and ICPs or ICBs. And then the second is through the lens using COVID as an example of actually the reality of how we came together, thinking about the community hub, the safer discharge for people, care home residents who were being discharged, or surge testing. I think that's really testament to the true nature of partnership across Merton. And I think colleagues would agree that you can't mandate the partnership that we have in Merton. And really in Merton, our residents, our communities are hugely lucky to have the team and the extended team that the board members represent. And I sincerely hope that over the next few years and beyond, these relationships continue to strengthen, because I don't think that there would be any challenge that couldn't be overcome with the strength of these partnerships. So thank you. And I look forward to watching from the sidelines. And I will close.
So before you close, if you don't mind, let me say a few words to you. I think we all owe a big thank you to you, the way you chaired and led us during these difficult times. You were a listening and hearing leader, not a telling chair. You are a perceptive and contextual leader, not a prescriptive chair. An understanding and empathetic leader, not a stubborn chair. And a value-based leader, not an opinionated chair. You never came across to me as a politician or someone who was interested in politics at all. You were always in tune with reality. You always understood the challenges faced by both the public and the service providers. You always balanced the need to support and challenge the system and the people who work in it. You're always calm, proportionate, reasonable, and very reasoned in whatever you said or asked or told. you showed me that one can do advocacy with purpose and passion, but remain situationally aware even when you do that. Always humble, always humane. A person whom I personally could have conversations knowing that you will not misunderstand, misconstruct, or misstate what I say offline. A true friend from the NHS perspective, a true friend who stood with us, who stood by us at our hour of need in the valley of exhaustion and despair. I think it was my good fortune that you became chair at the same time as I did, and I hope your predecessor doesn't misunderstand what I just said as he stepped down at the time I became chair. I think that one day you will look back and remember the days in Merton when the clouds were grey, when the mood was fear and fatigue, when the noise was of sirens and not of birdsong, that you were the chair of the Merton Health and Wellbeing Board, which looked after the interests of the people of Merton. So may I say to you, may my successor be blessed with a chair as great as you. May Merton build on all the good work you have led on, and may you succeed in all your future endeavors. Thank you.
Very kind. Thank you, Vasa. And
Can I just say,
This is our appreciation and gratitude.
Thank
You
you.
have been a fantastic chair.
Very kind. Thank you, Dagmar.
thank you. Could I endorse also those words and propose a vote of thanks to you, because I think exactly that. You've been an outstanding chair of the Health and Wellbeing Board for many of the reasons that Vasa has so eloquently stated. And yeah, I wish you well in your future endeavours. I'm sad that you have taken a decision not to continue as a councillor, because I think you've been extraordinarily good in the short period of time that you've been with us. And I look forward to reading about any future successes that you have. But certainly, I think you've been very inspiring to us through exactly that difficult times. And thank you for chairing so well. Also, like to echo your words that you gave to Chris Lee, who has also given, well, he's given extraordinary service to Merton for such a long period of time. And I would like to wish certainly him well. And yeah, for some people, it's definitely end of an era here with Health and Wellbeing Board, and long may though it continue the good work that everybody as a partnership has provided to it. So thank you.
Thank you, Una, and thank you, everyone. And I wish you all the best. And good evening and good luck for the future Health and Wellbeing Boards on the other side. Good night.